Welcome back. All right, welcome back. Today we are here, and we are with Nikki and Andrew, providers here at YourChoice Direct Care in Brighton. How's it going, guys?
Good.
Yeah,
Good.
great. Thanks for having us.
Yeah, absolutely. Glad to have you.
So what is YourChoice Direct Care?
So YourChoice Direct Care is a primary care office for all your primary care healthcare needs. Where we work a little bit differently. We're under a model of direct primary care. So it's a concept or a theme.
Okay.
It's membership based. So it's kind of like a gym subscription,
Okay.
if you will. You pay monthly, you can pay every 6 months, you pay a year up front, and you basically have your provider 24/7. You come here for all of your primary care needs. There's no copay, there's no extra cost associated with it. So we're all about availability, accessibility, affordability, reestablishing that patient-provider relationship in a good way.
Yeah, I mean, that makes sense with everything going on right now. People are freaking out because it's that time of the year when people start figuring out what the next insurance is, and this is another option.
People are
tool.
getting sick. It's sick season too.
Yes.
So that's just one more added stress.
Right. So you say it's like a gym membership. So I pay whatever my fee is, and then I can come in daily if I need to?
You could.
Huh.
Absolutely. No extra cost.
No extra cost. All right, so how long has this been around?
So this office has been around for about 10 years, 9
Okay.
years. Dr. Savage is also here with us. He started the practice. I've been here for about 3, and Andrew just joined us this late summer, early
3
fall.
months. Yeah. Something like that.
Still, I mean, this is a cool concept that I don't think many people realize about. How many would you say you have here that are patients, number-wise?
So I personally have about 450
Okay.
patients. Andrew is just getting started, so he's building up his practice, but coming along great with that. Dr. Savage has about 600 or 700.
Oh, wow.
The point of that is we like to keep our patient panels small,
Yeah.
lower, so that we can provide that good relationship and that service to you. So we have same day, next day appointments available because our patient panels are low. We're not overburdened with the calls and the emails and we need to get in now kind of thing. We have that open and available.
Yeah.
A traditional office, a traditional practice, you're probably thinking 2,000 to 3,000 patients per provider.
Wow.
So if you look at the ratio there, that in and of itself just lends us to a more open and available practice.
Yeah, so my mother-in-law works at a doctor's office, and the doctor she works for, he's at 2,500 patients.
It's a lot.
It's a lot.
Yeah.
And so, when I'm like, can I get squeezed in for this? She's like, the next available appointment's 2 weeks.
Yeah,
I'm like,
3 weeks.
Oh, okay, I'll go to urgent care if I need to then. It's kind of the whole point of it. It's
Exactly.
Then you go to urgent care and you got huge bills. You know what I mean? Like urgent care helps you in the moment and it's quick. That's great. But also there's a convenience fee that comes with it.
that's why it's urgent care.
And let's call it what it is. Nobody likes going to the doctor. Okay. And especially nobody likes dealing with the insurance part of things.
Right.
You know, and that's always been, the hardest thing for us to struggle with. And my wife found this a few years ago. I was like, the premiums they're affordable. You know, that's the biggest thing, especially when you have families. You could have a family of 4, your insurance could get up there quite high if you don't get benefits through work or anything like that.
Well, and especially with both of us that we own our own businesses.
Right.
Your wife has her own business. We don't get insurance through our
Right.
companies. We have to get our
Out
own.
of pocket, right?
Yeah. So I mean, this is a great option. So tell us about this office and the things that come with it. So normal primary office, what does that mean exactly then?
Sure. Yeah. So pretty much everything that you'd expect in a normal primary care office, we're able to do. And I would even say we're able to do more because just like Nikki was saying, we have such smaller panels, and we're not billing per appointment. So we don't have to schedule our day from 7:30 to 5 p.m. every 15 minutes. All of our appointments are 30 minutes to an hour.
Oh, wow.
So we have a lot more time with people. So whatever you can get done at a normal primary care office, we have more time to kind of cover more.
Sure.
And whatever doesn't need to be in our office, if it can be handled by a text or an email, we don't make someone come in because we're not reliant on that visit as part of our payment model.
Right.
It allows us to do a lot more telemedicine. But in terms of services we provide, like your normal annual physical, any kind of sick visits, I think actually contrasting that with having to use urgent care is a big benefit here.
Yeah.
Because like I said, we don't schedule from 7:30 to 5 p.m. every 15 minutes. We guarantee same or next day availability for our patients. So, if you have something come up, you text me and I say, hey, can you come in at 11? No, what about 2 o'clock? Okay, how about tomorrow at 8 a.m.? I got options for you to get you in. I like to use the example of like a urinary tract infection. You text me, I say you come in, a point of care urine test is included, so there's no cost there. We diagnose it and then treat it for 30 cents with our in-office pharmacy of generic medications that we have. That's an actual real-life example from a couple weeks ago. Contrast that to primary care office that's overloaded in the insurance system. You call them, you get quoted maybe 2 weeks out for an appointment. Okay, I'm going to urgent care. You get the copay for the urgent care visit. You get the payment at the pharmacy, and you wait in line at the urgent care for probably 2 hours maybe.
Yep.
So it just like really streamlines and simplifies it, and I think it's in a way that makes it a better patient experience and a better doctor experience.
100%.
Expedited healthcare.
Yeah.
Really it
You know
is.
what I mean? Like,
With somebody
yeah.
who knows you. And
Well,
somebody,
yeah,
somebody
absolutely.
who's invested in your health and your care. They know your background, they
For
know
sure.
your history.
I mean, that's every time I come in here. So, like, I've known Rachel since we were in kindergarten together, right? But she's kind of like who originally reached out to my wife and let us know about this place. And then immediately I was put on board with Dr. Savage. And I've clicked with him ever since day one. Like, he's the type of dude you walk in here and he's, we'll talk football. We'll just kind of sit there and BS back and forth. And like, you don't even realize you're at a doctor's office. You just feel like you're talking to a buddy.
Yeah.
And that's cool because I hate needles, as we've seen this before.
Oh, yes, you do.
I don't know how many times Rachel's called me. She's like, hey, you need to do blood work. And I'm like, I can find something better to do tomorrow. Like, she's like, oh, I can get you in this afternoon. Like he was saying, I can get you in now. I'm like, yeah, how about like 2 weeks? Like, I don't want to come in, right?
Right.
I'm trying to avoid it. But again, when you come in here, just everyone that works here, the behind the desk, in the back, like everyone's just super friendly and it's a really just inviting place.
It's awesome.
So what are the hours here then?
In-office hours are Monday through Friday, typically 8 to 4,
Okay.
8 to 3 on Fridays.
Okay.
But the convenience or the good thing about direct primary care is you have our contacts as the providers. You have our email, you have our cell phone number. So if something should come up, you contact us and we can talk to you, communicate with you, figure out a plan if needed over the weekend, in the evening, however it may be.
So run through a scenario. I come in to see you and I'm like, hey, woke up this morning, don't feel well, I can come in. And you're like, yep, you have ear infection and I need to get a prescription. Where do I go?
Yeah, so you'd have options. If you have an insurance and you want to say, hey, I'll run the antibiotic through insurance, go pick it up at the pharmacy, that's an option. Even after running your insurance, in most cases, we'd have the same price that we would just walk back into our office, grab your amoxicillin or Augmentin, depending on what you have going on, and we could fill it for you. You walk out with a little bag with your medicine. That's it. You didn't have to stop by the pharmacy. Didn't have to wait for that medication to be ready. We have it here, and usually kind of for pennies on the dollar. That's kind of the last 3 months since I've been here. Every time I fill a medication, I'm just like, that is crazy. The after insurance cost of that medication is still 5 or 10 times what we're able to get it when we buy directly from pharmaceutical manufacturers. It's the
Right.
same thing. It's just you take out all these extra steps of like pharmacy benefit managers, middlemen,
Or
all
everyone
these
that's
markups.
everyone that's trying to make a piece of the pie or get a piece of the pie off that, and when you
Yeah.
actually cut it down to just
Sure.
nuts and bolts, like it's really not that expensive.
Right.
It can be
It's really
affordable
not.
for people.
I was actually just reading something last night about it that a guy broke his foot. He went to the emergency room and he's like, I'm a cash patient, just flat out from the beginning. And he said, my bill was $250. He goes, if I would have billed insurance, it was $20,000.
It's ridiculous.
It's like, what? Because of all that. So, I mean, that's great for people that maybe are like us who have businesses that don't have insurance or are, can't afford the cost everywhere else. They can probably get it for cheaper or the same price here.
Absolutely.
So, do you guys have just adults here or you guys have, what ages can come here?
We can see anywhere from newborn all the way up to
So you guys have peds as well?
we do. So both Andrew and I see
Peds.
pediatrics.
Sorry, it's just the way I always say
Peds. Yeah.
We do see pediatrics. So at a newborn, a day old, we can see you here in the office for your routine screenings and follow-ups, and all the way through the elderly.
Wow. All right. Another scenario. I come in, broken foot. You guys can't treat a broken foot here, so what do we do at that point in time?
Yeah, so some broken feet we can treat. It depends on how complicated, right? If you
Sure.
need a surgery, you need pins. No, I can't do that bedside. It'd be great if I could, but I can't.
Impressive.
That's the next step. That's the next step, business,
Yeah.
right?
That's
So,
what's next.
so yeah, like we would then refer out to a surgeon for that. But if it's a minor break, we can get you the supplies you need, like whether it's a walking boot or post-op shoe, depending on where it is, and do the initial X-ray through a local imaging center, and we can get cash pay rates there. I don't have foot X-ray off the top of my head, but I can tell you, like, for example, a lumbar spine. I looked at the local university health systems like price transparency tool. They charge $3,770 for it.
Ooh.
And at the local imaging center that we work with, we can get it for like $370. So like, again, it's
Literally
literally a
tenth
tenth
of
of
price,
the cost.
right.
The price. That's
Yeah.
ridiculous.
So it's pretty crazy, and I mean the same. I think the X-rays are all like under $100, best I
say
can
close to
remember.
it.
So they're like pretty affordable.
I mean, even blood work is like $50 or stuff like that. Like everything is super affordable, and it's sad because it literally makes you look and just see how much healthcare is padded and boosted up, and just people looking to make money. And that's one thing here too. Is like, even as far as medication goes, you guys don't push medication on people. You know what I mean? I don't want to say this is a holistic style or that crunchy, but it's also, you're not saying, hey, you need this, and this to fix you. Here you go. No, it's let's work through this. You know what I mean? Let's start at the bottom, not just let's throw medication at it, hope it goes away.
Yeah.
And I feel a lot of big pharma, a lot of big places, that's what they're going to do. Write you a script, get out of here, next.
I think when we're writing these generic meds and like you see the price tag on them, you know that we're not making money on them, right? Like we're selling them to you basically at cost. So it's like if we think you need the medication, I mean, you can trust, like, we're not marking these up. You can see it. It's like blood pressure medicines we can fill 90 days for like less than $1.
It's crazy.
Pretty often. Things like that, So and to be clear, the people working in insurance-based primary offices, they're great people. They're working in a broken system. Like that's the thing.
It's not the people.
Yeah.
They're not the crooked ones. It's
Exactly.
It's the people that laid down the path prior, and it's all about chasing the buck.
Yep.
Yeah. It's funny. Dr. Savage likes to say, like, in every other situation, insurance is like a hedge against financial calamity. But in the healthcare system, insurance has become the financial calamity. It's like prices are high, so we need to have this third party come in and pay for your medical care. And then the third party comes in and adds layers that raise the prices, making it therefore more justified to have this third party. And it's like this feedback loop of increasing prices, justifying the need for insurance because prices are high. But in primary care in particular, prices are really not high. The prices are inflated to cover all the other kind of like specialty care and all those things. So the reality is, like, primary care does not need to be expensive.
Yeah. And I mean, I feel like a place like this is you'd want to come to because they're going to be open and honest. I have friends that work in the DEA and Health and Human Services, and they're investigating insurance fraud all the time for that because there is that loophole and the extra padding and everything else where you're going to get it at cost. It's going to be really hard to make something happen here where it's like, oh, you charged me an extra $1 on one product because you had to cover a cost. Like, it's going to be hard to do that.
Mm-hmm. I think from the patient standpoint too, we give you options.
Right.
So we're not dictating here, you have to go here, you have to do it at this location, which a lot of the bigger offices and bigger corporations, they're doing that now because they're keeping things in their network. So here we give you options. You can fill the medication if we have it here in office. If you don't, we recommend GoodRx as a good resource to people who maybe don't have that coverage of that medication. So you can go to any pharmacy and you can use a GoodRx coupon or a card and still get a discounted rate on that medication. Similarly with the imaging or radiology services, you can go to a bigger facility to get that done. You're going to pay more for it, but we recommend regional medical imaging for that. Just as a good, solid, they're reputable, we know them, they have good prices, they're transparent with them, which is important from that provider-patient relationship.
So you talk network. Do you guys have a network, or are they individual locations?
This is us.
We're
We're just one. We're not a franchise. There's not other YourChoice Direct Cares. Direct primary care as a concept or as a theme. There are other DPC offices that are local. In the Detroit area, it's Plum. They're a bigger one that's kind of spreading and growing, but there are a few individual offices.
I was going to ask too, are you guys seeing that this style of healthcare is becoming more of a trend? Is it picking up?
Yeah.
Okay.
Definitely.
Yeah, definitely.
Okay, and you know, obviously, I'm not in the industry. You know, that's the furthest thing that like I don't look at. I know you guys here, but it's definitely something that more people are starting to kind of get on board with.
Yeah, I mean, I think it, like I said before, I really do think it's a win-win. It's you'll notice like the small private practice doesn't really exist anymore, and part of that is because if you're going to exist in the insurance system specifically, and obviously we are outside of the insurance system, but if you are, you have to really churn and burn through a lot of patients, and there's a lot of support staff. There's like layers and layers and layers of people trying to make that more efficient, trying to make your coding, you know, as high as it can be without being fraudulent and things like that. You know, it's really hard to do that as a private office. And once you give up that private label, then you're kind of beholden to the algorithms and the referral networks and kind of the things that insurance puts on you. So I really think from a doctor's standpoint, breaking out of that system and being, you know, in the direct primary care system where we're not, you know, when I write my office notes after I see a patient, the notes are for me and for the patient's record, right? I'm not sending them to insurance to say, hey, this is a level 4 office visit and you need to pay me X number of dollars for it. No, those are just for me and for the patient, right? Like that's what my notes are for. And so that just makes that such a simpler system that if you want to have a private practice and kind of practice with a little bit more freedom, this is really, best I can see, the only way to do that and kind of break out of that system.
It's almost like we're kind of reverting back to olden times where those private practices are going to start becoming more popular because people want that again. Like
It takes a village, and that's kind of what this is. You know, it's the way my wife describes it is that like everyone throws in the pot, and then if I need it, well, we've all kind of thrown in, right? Is that kind of how the gist of it works? No. And where it all kind of pays towards like the same premium.
Oh yeah, so yeah, I think everyone's you know, monthly membership is what makes the office be, you know, feasible.
That's what I mean. Like we all kind of like when everyone's here, we all kind of pay that minimal fee. It adds up to then we can all benefit from it. It's not, you know, it doesn't really base off of each person's individual insurance provider they may or may not have.
Yeah, there's not necessarily an incentive to drive like productivity and get people in the door and out the door kind of thing as quick as possible. Yeah, that's the beauty of the membership model, I think. Yeah.
But that brings up a good point too. So
that's a good question, Nick.
Oh, yay, Nick finally did something, yay.
Hooray.
Aaron.
But from the standpoint of like coverage or insurance, a lot of times people will ask, do I need to have insurance, or is this a clinic where I can come to if I don't have insurance? We have a mix of patients who have insurance, who have Blue Cross Blue Shield, who have Priority Health, who have Medicaid, who have Medicare. We have them all across the board. We also have people who don't have any insurance at all. So it's a good mix because you're coming for the services of we're available. We want to develop that patient relationship with you and have that rapport. We're affordable. So people do have insurance, and maybe they have a specific plan that meets their needs. And we can sit down in an individual basis. Andrew and I do meet and greets all the time, just kind of going through your personal scenario and what would work best for you in terms of the plans that you can choose. But we always recommend that you have some type of catastrophic coverage in a sense, just because you never know when that is going to happen. So it sucks if you don't have that for sure, but we do recommend that in some way, shape, or form you have the catastrophic, and then we work with you with the rest of it to try and make it feasible.
So let's talk about the plans. What kind of plans do you guys have here?
Yeah, so through our office, I mean, again, that's kind of the beauty of it is a simplicity. We don't actually like offer an insurance plan. Right. Just like basically we just take care of the primary care needs and kind of coordinating care if anything's needed outside the office. But we'll work with just about any kind of plan or situation. There are some that work really well. So, you know, open enrollment, I think, is coming up, or it's even started, right? Yeah. But like an example, something that probably works the best is like a high deductible plan with an HSA. Recent legislation just made it so you can actually use your your health savings account to pay for our monthly membership. Oh, wow. So now that becomes pre-tax. So you're looking at, you know, $59 a month as a starting membership for Nikki, or $69 a month for me and Dr. Savage. You're looking at that being pre-tax, so, you know, probably a 30% decrease in that cost in terms of what you're actually paying. And then, so that's one thing. And the other thing is those plans are a lot less expensive and they don't start covering things until you spend more. So if you have a cheaper plan with this kind of disaster insurance if you have to be hospitalized or something, and you have this health savings account, you can put money in there, and if you have to spend it on anything through our office, that's great. If you don't, it's actually a pre-tax investable account, right? So you can then be investing the money from the HSA, and you're not taxed on the capital gains from that.
Right.
And you're not even taxed when you spend it on health-related needs. So that is a really, I think, powerful tool. A high deductible plan with an HSA paired with a DPC membership is just a really great way to kind of optimize what we offer here. We're not insurance agents.
Right.
Part of the reason that we do this kind of practice is because we don't love insurance, generally speaking, and all the hassles related to it. So I'd recommend you talk to someone while you're trying to figure out what's best for you in your situation. Look for someone who has the fiduciary tag, which means that they're obligated to give you the best information. They're not selling you a particular plan. So point people in the direction of someone like that to look at different options. But so we don't offer a plan, but we work with just about any.
Gotcha. Do you do like a family bundle versus just individual or anything like that?
We just talked about that actually.
Okay.
We haven't historically offered that, but there is a need and a want for it.
Okay.
So yes, we are able to work something out with a family plan.
That's awesome
for
to
you.
know. All right, so before we wrap up, is there anything else you guys would like to add or ask or anything?
No, I think we're here in a direct primary concept to make things affordable, to make things available, and we're accessible. We want to build that relationship with people. It's a great option for individuals, for families, whether you have insurance coverage, whether you don't. We're just here to take care of people in the best way that we can.
I would say one thing to add right now, depending on when you're listening to this podcast, we are doing a free month promotion for new patients. So if you're listening to this and you're kind of I don't know, right now with no strings attached, people can sign up, get kind of a free month with that 24/7 access, unlimited appointments, access to our generic meds, and kind of resource coordination. And then from there, we're confident we'll either impress you enough that it's going to work for you, or we'll impress you enough that you're going to talk to family, friends, and people like, hey, this didn't quite work for me in my situation, but this is a really cool model that's out there. So yeah, we're doing that kind of no pressure free month thing right now, limited time, like I said. And then we also, like Nikki alluded to earlier, if you're just kind of wanting to hear more, ask some specific questions based on your circumstance, we are inviting people to come and do a free informational visit as well. So quick 15-minute sit down, ask us whatever questions you have, things like that.
All right, so let's play a little questionnaire before we wrap up. All right, so we're not patients, okay? What questions you got as a non-patient? What would you ask? I got one off the rip. I'm up in Traverse City, and I'm sick, right? Obviously, the disadvantage of you guys not being a network, I can't go find another close business or something to do. But I have your number, so I could reach out to. How would I go about that?
Yeah, I have a good example of this. I have a patient who's part-time here, part-time down south. He called me before he's going on a business trip. Was worried he was getting a sinus infection, right? So went through, talked to him, was able to send him medication, to be available if he needs it. He's just going somewhere where medical care would not be as good, not as developed a country, so to speak. So he just wanted to have that in his back pocket. Sent it to a pharmacy in the other side of the country, basically. They were able to find one for him, and he got it a couple hours before he took off to leave the country, kind of thing. So we can. That's the advantage. You'll be hard pressed to find that. If you're billing by appointment, because the incentive is to say, hey, we should really evaluate this, have you come in, things like that. But if it's reasonable and we're able to do it, I'm not going to handle your acute appendicitis over the phone while you're out of town. You know what I mean?
It's more that telehealth still that you can do.
Yeah, the things that are reasonable for us to handle, we do our best to do that. Yeah.
With no extra charge.
Yeah.
That's right.
So
You've already paid for it.
how do I telehealth you then? Just phone call, FaceTime? Is there an app? How does that
All of the
usually?
above.
All of the above.
Dealer's choice.
Yeah.
Okay.
You can email, you can text, you can call, we can do video. We try to make it easy. Any one of the above. Yep.
So I guess the question I really have is, what's the downfall? What's the big we can't do that with this versus other models because everything keeps adding up. Like, yeah, that makes sense. That makes sense. What's kind of like the catch? Like, what is there?
I think what I hear people say the majority of the time is, I don't want to pay something else out of pocket. Like, why would I pay this? Which we've kind of already answered those questions.
Right.
But for people who do have insurance, like I have insurance, why would I pay something extra on top of what I already have? Again, I think we've already answered all those other questions for that. So I think the number one reason or response that I get is it's just more money out of my pocket. That
Which
maybe they don't have the value to that yet, and they don't know it because they haven't experienced what we can offer and provide them. Which, like to Andrew's point, we have a free month. So come in and understand that value, and we are convinced we will give you that value to pay.
I mean,
that
just
extra
the
cost.
saving on the prescriptions alone. You know, you pay your $60 a month, whatever it might be. You know, some people that may be medication heavy for whatever their reasonings may be, you know, they could be spending hundreds of dollars a month on prescriptions. But you guys are able to cut them at cost for them, and they're really only paying 60, 70 bucks, whatever it is. And I think right there,
it already equals out.
There's the spot. Yeah, it's out of pocket. Yeah. However, it's still
Looking at
less.
the alternative, what you're comparing it to.
Yeah.
But also, I think it's just an unknown. Like direct primary care is a concept in general. People don't know it. People don't understand it. They haven't lived it. So just getting the word out, getting awareness out, just the knowledge of direct primary care in general. It doesn't even have to be our office. If you live somewhere else that you're closer to Plum Health or you're closer to another DPC, I would encourage anybody to just look up DPC or direct primary care in general as a theme.
Just educate yourself and just see if it's something that works for you.
Because you do have options as a consumer. And as a patient, where you shouldn't be or feel stuck in a system that you have to go down that path.
Right.
Yeah, and I would say the other maybe like to respond to your question too, the barrier is just it's a mindset change. You know, where people are kind of like, oh well, you know, that gets taken out of my paycheck. Like I don't really feel like I'm paying that if it's coming through their employer. But you know, the interesting thing is if you look at the out-of-pocket max for a lot of those insurance plans versus the out-of-pocket max for a high deductible plan, they're pretty close. So the funny thing is if like, I guess it's not funny, but if you have like, you know, the worst medical year of your life, you'll end up spending a pretty similar amount. But the difference is for the years that you didn't use your insurance, you're paying like pennies on the dollar with this high deductible plan. So you're saving all that money and you think, hey, you know, like, but when I have, you know, my bad time, this insurance is going to bail me out. And it's like, no, because when you see those really big hospital bills, the co-insurance will get you to basically the same cost. It's very close. So, you know, doing like a high deductible plan approach paired with something that gives you price transparency for your outpatient care, it's a different mindset, and you kind of lose the sense of security from the good insurance idea. But when you actually, you know, look through and you look at the projections, like for the worst medical year of your life, I don't know, those costs are about the same. So it's kind of like you have this idea that insurance is, I have good insurance, it's got me covered, but you're overpaying for it.
Right.
So yeah, it's a mindset change, I think is really like the big barrier. But as far as I'm concerned, like I really don't see a catch. Like, for us, I don't see a catch, and for patients, I don't see a catch.
And I tend to agree with you. Like the catch is, it's the mindset as well as, well, I'm already paying. Why am I paying more? Like, and really, you're not.
What are you paying for?
Right. Exactly. So we'll end on this, and this seems to be the new final question we've been asking. What's next? What's next for you guys individually? What's next for your choice? What's the next 5, 10, 20 years? What's next?
Like, are you guys looking to like branch out? Do you like just having the one location? Are you
going to need a bigger business?
Like how many patients do you want to cap out at, or you think you're at that spot? Or
so I think Andrew coming on here recently, we were at that point where our purpose is to keep the patient panels
keep it low, right?
So when we start adding more and more on, when I came, now we have more and more patients, so we want to provide the same service, so we do bring on somebody new. So I am not the business owner, but I would say that if Andrew continues to grow and we've reached those max of 600-ish patients, I would say is it about
there'll be another Andrew a couple years down the road or something like that.
Absolutely.
There'll never be another Andrew, of course. You knew what I meant.
Yeah.
But I would probably say that.
Just continue to grow then.
Yeah.
Continue to grow and adapt.
Yep.
Yeah.
Cool. Yeah. I mean, that's a very fair answer, and one that is the right answer, right? Because you could have people being like, we're going to do 50 businesses and this, and it's like, just focus on the now and
Correct.
see what happens.
I would say
Keep the
that's a very
intimacy.
good.
Keep it low key. Keep it comfort. You know,
Yeah.
comforting. Sorry.
Yeah, same. But we appreciate you guys having us out to this location. I will put all their socials and all their links and their website and hours and stuff on the end of this. And then you can reach out to them and talk about them when that free month is, if there is still available, or just have a sit down with them and see if it's worth a shot for you guys. So appreciate you guys coming on, and we'll talk to you guys soon.
Thanks a lot, guys.
Thank you so much.
Boom. You know, I bet if I would have eaten that dried fish,
You would have been here.
I've been here.
It's true.
There's no way that was fresh. Like that.
It was dried. It was dried.
I know,
and it was
but
dead.
that's what I
and
mean. There's no way that it was within the last 5 years.
I mean, I guess that's the point of this, right? If you would have ate it, you could have been here. We could have filmed 2 weeks earlier.
Two birds, one stone.
Two birds. I mean,
Damn.
let's just talk about this model. Makes sense for business owners or people that aren't even business owners.
It
But
does.
I mean, I'm already going to text my wife as soon as I leave here and go give them a call.
Yeah, give it a shot. You know.
I mean, we gotta figure something out. I mean, it's perfect timing because it's that open enrollment where people can start figuring out their insurance and everything else, and we have to figure out what we're doing. So
You got kids in school, so you know they're gonna be coming home with the sniffles soon.
they already have.
You
so
know what I mean?
and
That's-
we're in the doctor's office all the time for them, and
Yep.
obviously, like we have insurance now, so I agree. That's the downfall, right? We have insurance. Why would I pay more? But
However,
it makes sense when you
does.
sit down and talk to them, and that's the thing. They're willing to sit down and talk to you, right? Why not? At least have the conversation.
Yep.
Even if it costs you, $1 just to come talk to them, which I doubt they would, but you come and just talk to them, it makes
Jake will
sense. to just
Venmo
do
you,
it.
it's fine.
Nick's Venmo is. But yeah, I think it'd be worth it just to even have a conversation with it. I didn't know this was even a concept, and it's brilliant.
I didn't either. Apparently,
Right? Like
even when what are we talking about this week? I don't know. What are we doing?
when you reached out and said we're going to the doctor's office on Monday, I went, for what?
Right. Are we getting colonoscopies
Right.
together?
We're holding hands.
Hey, do you guys do that here? No, that's a bummer.
You want to try?
Yeah.
Nick will be your patient. For
Rach,
it.
we've known each other for a long time, honey. It'd be just like brother sister. It's okay.
I don't think that's good.
Jake's got a camera. We'll just put a glove
Yeah.
on it, and
Yeah.
Jenny, you can watch. I'll watch. Yeah. She'll be like, no, I want to help.
Yeah. I'll hold him down. It's weird though because a lot of things have gone to like that streaming subscription based, and you're like, I don't want to pay for another subscription, but this one is worth it, right? Like I don't need another Disney or a Hulu. Like this is my health and what I don't know keeps me going, and it's great because, like I said, we're both business owners. Insurance is expensive as a business owner.
Yep.
And this is just another tool in your toolbox, you should say, right? Like,
And they're
it's
not
just
looking,
different.
like I said before, they're not looking to offload medication on you,
Yeah.
and they're not just trying to push out the door. Like you can have intimate conversations, and you can, you get to know them well.
Well, and that's the thing also is like, since we've been here, it's been very friendly and welcoming where, I mean, and I'm not saying all doctors are that way, but a lot of them are that stuffy, like we've said in the past, where it's corporate, it's turn and burn, turn and go. And it's like, here, you can sit here and have a conversation with somebody and feel that family welcomeness.
You
And
almost
that's what want.
you almost feel there's like being judged when you go to doctors sometimes.
Sometimes, yeah.
You know what I mean? Especially when they're asking you about like, what are your life choices? You're like, I drink and smoke at 10 a.m. on Monday mornings.
On a Monday, like, have you ever, one of the questionnaires is,
Right, exactly. You're like, I keep bourbon all the time in my car. Like,
the questionnaire you filled out is, have you ever done a shot at 10 o'clock in the morning on a Monday?
check.
Are you considered an alcoholic then?
Check.
Right? Like, it's our
just
job,
yeah,
right? We
yeah,
got
no
to.
big deal.
They pay us a lot of money for this. We got to do those shots.
Getting paid?
Shit.
Wait a minute.
But I agree with you. Like, it can feel very
Intimidating.
yeah, and you don't almost want to go to the
No,
doctor.
because you're like, you don't want to get in there and they're like, hey, when was the last time you worked out? When was the last time you didn't drink, didn't smoke? You're like, wow, I'm a piece of shit. Like, I'm embarrassed to tell you all these things. I haven't worked out in 6 months. I drink like a fish and I'm a pothead. You know what I mean? Like, then
How do you get my doctor charts? Like, well, it's weird. Like when it's like fill out like, how often do you drink? You're like, I don't know, like 1 or 2. And it's like a day, a week, a month. Like, I don't want to answer that.
This is embarrassing.
And then you're like, what is this guy really thinking of me?
Yeah,
What
and
are
that's the thing is,
Yeah.
yep.
And they get it here. Like they're like, you work in the bar business. I know you're gonna have a drink or
Right,
two.
kick
Like
back
it
a
is
few
what
shot
it
or
is.
two, and and that's what I'll talk to my doctor, and he'll always mention, be like, all right, obviously you're still working out, this and that. He's like, what are you doing? And I'll tell him, and okay, well maybe try to throw a little bit of this in there, but if not, you're not in bad health. But here's something you could try, but they don't make you feel bad about not doing something that you're not doing.
And I think that's also the big stigma is people don't want to keep spending money on things they don't need. And a lot of things are like, why would I pay for another subscription?
Yep.
Well, this one, like I said, is important. It's our health. These are things that you need to spend the money on. And if this is just another option, it makes the sense. So
It does.
In my opinion, it is 100% worth a shot. Like I said, as soon as we leave here, I'm going to have my wife reach out and get in and have a sit down and see if it's worth it for our family.
Yeah.
And it might not be, right? But I don't know until I have that
So you
conversation.
at least come in here and talk with them. You know what I mean? Like,
They might sit down and say, well, what are your guys' needs as a family? And we go through all of our problems and they go, this is more than we can handle here, right? Like, I don't know, right?
wow, you are fucked up.
You need to go see somebody way more than
Y'all
us.
need Jesus.
Right. But it is, I do like that because I kept sitting here going, I would never sign up for this because if I'm in Vegas or something like that and I'm sick, I can't go to the local doctor and be like, oh, you're a network. I don't have that. But I can just text him and go, hey, I got a sinus infection while here in Vegas. Well, hold on, let me reach out to one of my contacts and get you a script right now.
Sure.
And that's
why
great.
you don't get bad Coke in Vegas.
Well, yeah,
You have a
but
sinus
that's
infection.
fine either way. But it's just things of that nature, right? Like
Yeah.
it's good to have that, and it feels good, right?
Mm-hmm.
Like people care about your health, your future, and want to be there for you.
Mm-hmm.
And to know you're one of 600 versus one of 2,500,
6,000, yeah,
right?
or whatever it might be.
Right, and then you walk in and the people front desk are like, "Oh, how was your weekend? How was this?" And the other person's like, "Name a number."
Yeah.
Like,
Hey, fill this out. We'll call you when you're ready.
Right.
How many times you go to a doctor's office too, where you're like, you have an 11 o'clock appointment and you don't even see the doctor till 11:45, and then you've got one person that comes in there and they do all your vitals and whatnot, and then the actual doctor comes in at 12:15 just to say, "Hey, how you doing? Looks like everything checks out," and then you're hit with a bill as you're walking out the door. Do you know what I mean? And
Every single
there's
time.
2 hours of your day that's been taken up, and you felt like nothing got accomplished. Here, it's in, it's out, it's straight to the point.
Well, and that's the thing. Like, so my mom's got cancer, right? So she goes to doctors all the time.
Mm-hmm.
When it's a doctor appointment day, we know it's 5 to 6 hours.
You know
and it's
that-
just for a checkup. Like, how's everything going? Good. But we get there, she checks in, they do her vitals, she sits in the waiting room for another hour.
Yep.
Then she goes back, they take her in, they talk to her, and then it's like, all right, we have to do a shot. So then we go back, we wait, and it's hours on hours. And obviously it's a little bit more intense, but it's the same thing even at her primary care because they overbook.
Yep.
And that's, like I said,
And it was nice to hear him too. It was like, you kind of asked him what's next and this and that. With Andrew just starting on board, again, like I said, there'll be a new Andrew at some point. Once they hit a certain level, they're like, all right, we can't give the same premium care that we've been giving. So, we're going to, like, this building will probably become too small someday. You know what I mean?
Right.
And maybe not now, maybe not 5 years, 10 years, whatever it might be, but they're going to continue to bring on more people so they can keep the intimacy lower.
and I think a lot of times when you ask somebody what's next and they kind of, they say what everything is. When I asked them what was next, they couldn't give me an answer. And a lot of times they're like, oh, they don't know what they're doing. But it actually made me feel more comfortable. They're not worried about what's next. They're worried about the here and now.
Right, they're living in the now, and
Yeah.
they're doing what they chose to do.
Right.
And that's why I kind of asked, what was your background, this and that, and Andrew was just finishing up his schooling and everything. He went directly into this, and that was something that he wanted to do. And Nikki had mentioned that she had been in a few other places before. 15 years she's been in the industry and whatnot.
3 years here.
and then now 3 years here.
But as we've been here, we've been the only ones in the waiting room. That's unheard of.
And everyone literally, they walk in, they go, I'm here for so and so, and they go right in the office.
Right.
Like we're seeing this firsthand, exactly what they're talking about.
Right.
We're the only ones that are actually sitting out here.
All right, so obviously, like I said, I put all their contact information on there. I'll have everything again for those that need it. It'll be tagged in all of our descriptions, everything like that. So if you want to reach out to them, which I highly advise you should, make sure you do so. See if that free month's still going on. But yeah, it's worth a shot. I mean, obviously you go here, so you know it's worth a shot. But
Tell them Nick and Jake sent you.
it is. We get a big referral of $0. But no, I mean, it's good to people that watch it and actually say, I saw it. I signed up. That'd be nice to actually know we're doing something here
Right.
because we never do. So, But yeah, no, like I said, I'll have all that stuff in the description so you guys can follow all that. Follow us on our socials, and we'll see you guys in 2 weeks.
2 weeks. See you guys. I said the same thing in bed last night.
I don't know what you're talking about since I just turned that on.
Oh, damn it. It's even worse.
All I heard is, I said in bed last night. That's all it said.
So that was the first time I got crabs. Smells like sex in here. I need a doctor.
I needed one bad. Anyways,
You're not wrong.
I'm not wrong. That stays in no matter what.
Yeah,
I'm not wrong.
Jake was right. Ooh.
Nick was wrong.
Hey, whoa. Like, why am I throwing this?
You're wrong.
Anybody want to say hi to?
We got
Hi,
him.
Mom. Guy.
Always mom. That's right.
All right, let's turn this bitch X-rated.
Let's go.
Oh, yes, my muff.
Where do you want to sit?
Probably right next to
Want to
you.
be intimate?
Oh, my God. Better than the cup chair. Want one, Rach? I won't tell the boss.
Don't worry. Just didn't
Jenny,
start,
you want one?
I didn't just start the camera.
That a girl, I got some bourbon. You figured out, that's what you do. You figure out
I
everything.
figured out and say, hey, this is what we're supposed to do.
I just show up.
Just don't give me till Sunday to do a whole podcast like I did this weekend because that was nerve-wracking, but whatever.
That's all right.
That's what we should do. We should get with a chiropractor.
Piss our pants?
Well, nope.
what we should
nope,
do.
we should not piss our pants.
But
We should
it's
get
the
with a
coolest
chiropractor.
thing.
It's the cool. Peeing your pants is cool.
Actually, I got...
All righty.
Are you hard? All right, let's hurry up. Let's get this done. There's somebody walking in.
We'll wait for him.
Okay. Look out.